I want to talk a little bit about preterm labor. And this often comes up in conversation because patients will ask me, when do I go to the hospital? And it really depends. If you're 36 weeks or later, it's a whole different set of criteria. But we're talking now before 36 weeks when you're really preterm, particularly, if you're 28 weeks or something like that. And what happens is, for some people, their body tries to go into labor early before the baby's really ready to come out. We don't really know what the causes of. Some of the causes we know, but a lot of times it's really just unknown and it just happens. In some situations, if you get to the hospital early enough, we're able to treat that and stop it so that you don't have the baby early. So what are some of the signs of preterm labor? Well, most women have some contractions in the third trimester, even early on. We call those Braxton-Hicks contractions. Contractions are a tightening of the uterus. The uterus is a muscle. It's basically just like any other muscle in your body. When you contract, the muscle squeezes. So it's kind of like making a muscle in your arm. You can feel the difference when you're not making a muscle, it's soft, and when you make a muscle, it's hard. Same thing with the uterus. So when the uterus contracts, it's like making a muscle, and it'll feel hard. Braxton-Hicks are sort of usually not too uncomfortable, but occasionally they are, tightening of the whole uterus, and that will last maybe 30, 45 seconds and go away. As long as that's only happening occasionally, that's nothing to worry about. That is not preterm labor. The criteria that I use and most people use for sort of preterm labor is 6 contractions in an hour that aren't going away. So in my practice, what I recommend my patients do is that if they start feeling contractions like that, and they're starting to come a little bit more regularly, that they time them. If they have more than 6 contractions in an hour, I ask them to drink a bunch of fluids to make sure they're not dehydrated and lay down. A lot of times that's enough to make it go away. But if that second hour they're still having 6 contractions or more, then I really think that you should call the hospital and go and be checked out. It might be a false alarm, but it might not. And if it's not, and you get in at that point, it's usually still early enough that we can treat it and make the contractions go away. Now, the treatment of preterm labor is usually a combination of things. As I said, if you're dehydrated, that can cause preterm labor. We look for other things that might be causing it. For instance, a urine infection can cause preterm labor. So we would treat you for that if you had a urine infection. Most of the time, though, we don't really find anything specific, and so we treat the contractions themselves. And there's several medicines for that. There's a medicine called terbutaline, which is often given as a shot. That has a side effect of making your heart beat really fast, but it works very quickly. And we'll often use that sort of as a test to see if that just sometimes that'll just knock them out and make it go away. Other medicines would be magnesium sulfate, which is a medicine that goes in the IV. For that, you'd have to stay in the hospital for. There's also a pill called nifedipine that can make your contractions go away. There's other medicines as well, but those are sort of the most commonly used ones. And so depending on the situation and the severity of the contractions, your doctor will choose what medicine to use if any medicine needs to be used. The other thing is bed rest. In cases where people in preterm labor, bed rest definitely can help, and so that's usually prescribed as well. Now, bed rest is a big hassle. If it's really serious, they may need to even have you on bed rest in the hospital rather than bed rest at home. But that would be something that your doctor might prescribe. But the big thing is, if you're at home and you're having contractions and they're regular, and you're having more than 6 in an hour, and they don't go away by laying down or drinking fluid, you really need to go to the hospital and be checked out. And that's really the safest thing to do. And hopefully it's a false alarm, but if it's not, then usually that's something that can be treated at that stage.
Medtwice.com